continue our tour around the world. Today I am joined by Marja Agema, I think. I'm not sure I pronounced it right, but I'm sure that she doesn't mind. I want to thank her. She is from the Netherlands, or Holland, as many of us know the country. She is in Rotterdam. So, hello, Marja. How are you?
Hi, Nancy. I'm fine. Thank you for having me.
Thank you very much. Marja, I haven't heard much about the situation in the Netherlands. Can you tell me what's going on and when did it start, if it started, and how long has it been, and how you're doing and how your family is doing, please?
That's a lot. Yeah. Well, fortunately, my family is all healthy, so that's a good thing. Even my 80-year-old father, he's all right. So that's the most important thing, I would say. In the Netherlands, as everywhere, I think we have a kind of lockdown. So we have an intelligent lockdown, as we call it. So we are allowed to go outside, even for walks or cycles or whatever, but try to minimize it as much as possible. That's the verdict. Um, Work at home. It started in the Netherlands in the south after the carnival. That's mostly celebrated in the south of the Netherlands, and so the first infections were there. As I was working in a company that is actually located in the south, I'm already working at home for more than 4 or 5 weeks. But then the whole country shut down in a sense. So we're not allowed to go to work unless we really have to. And a lot of people working at home. Um, Schools are closed. Um, Restaurants are closed. Theaters are closed. So sports clubs are closed. You cannot meet anywhere. You're allowed to go outside, but with not more than 3 people. And in principle, you have to stay away from each other 1.5 meters. You're only allowed in the supermarket with one person per family. You have to take a card. Everything is cleaned, and etc. etc. Well, that's good. Um, what else? Um, well, I think the hardest is for parents with young children. So I have 3 children, but fortunately they are older. So 2 of them are in university, and one is doing his exams this year. The oldest 2 have come home as well now. For them, that's more convenient, of course. For me, it's quite busy in the house. So working from home is sometimes a bit complex because they also have to do exams online. Fortunately, they didn't overlap in exams yet, so that was a lucky coincidence. And my youngest, he's actually quite happy because the central exams in the Netherlands have been cancelled.
Oh,
And that means that with the grades that he currently has, he already passed.
oh,
So
nice.
without doing it, he passed his exams.
Very
So
nice.
he's the lucky one. My daughter, she cannot start in the hospital. She has to, I don't know, internship, but probably it's called. That's not allowed at this moment. So she will have to wait for that to restart. And my oldest son is trying to do he had to do a practical. He's studying chemistry. He had to do practical, but that's now going to be a theoretical practical. So he's somewhat affected as well. So we're lucky also with the weather because it's really nice weather and we have a garden. So it's really good. We can actually sit outdoors.
And what do you think is the biggest challenge that you've had within the Dutch situation? What's the biggest challenge that you've had?
So for me personal, I think I'm not that much affected because fortunately I don't have any parents in an elderly home or something. But I think a lot of individuals, they miss the contact with family and with friends a lot. So you can do it online, but it's not the same, right?
Right.
So that is, I think, the challenge that people have, and especially if you have family members that are um, susceptible to the virus or handicapped in some way or have and not living at home, you cannot visit them at the moment. I think that's quite harsh for a lot of people. From a government point of view, their biggest struggle is to get enough IC beds available, or ER beds, as you say, I think in the US. So they have scaled that up. Unfortunately, because we all were quite good in staying at home, actually we never reached the maximum that they have available. So there is sufficient support in the hospitals for those people who have to go there.
So do you think that this physical distancing and isolation has helped to contain the severity of the epidemic in Holland?
I'm sure.
Yes.
Yes, especially in the south, it went skyrocket when we didn't know the virus was amongst us, right? And there was this partying going around, just unlucky, the same timing as the carnival. And up to a couple of weeks ago, it kept going up exponentially, the number of ER beds that were needed. And now it's stabilized and it's actually even going down a bit. Obviously, there are still a lot of deaths to, a lot of people lose their loved ones. If you look at the statistics, it's probably twice the amount of people than with a normal flu epidemic. So
And is there any talk yet about how to reopen?
Yeah, that's starting. They're starting to think about it. There's a lot of discussion about using an app like they did in China, but there are a lot of privacy concerns with it. So I'm not really sure whether that will work out. It will never be like I think in China they're probably obliged to do it. You can't do that in the Netherlands, so it will always be on a voluntary basis. And I'm not sure if that it will be working. My guess is that they will start first with the schools because the younger people are less affected by the virus, and then they will slowly open up things. But businesses cannot, exist in this situation for more than a couple of months, and then they really have to go back to kind of normal life. But fortunately, in the Netherlands, we do have a very good social security system, so nobody has to be hungry, and we also have a very good health insurance, so everybody can get the help that they need. So I think I'm very lucky living in the Netherlands.
Well, that's fantastic. I wish we had the same thing here.
Yeah, exactly. Yeah.
So any advice that you have for us? We are, I think, starting the leveling process, but there's been some folks that really want to open things up very quickly, very rapidly. What are your thoughts of just opening everything up without a measured and thoughtful plan?
I would be very concerned. I think you only need a couple of people having the virus and it starts all over again. If you have sufficient ER beds available, I would suggest anyone who has diseases or is not completely healthy or elderly, stay at home. Even if everything is open again, stay at home as much as you can and avoid crowds. Make sure that you distance yourself from others as much as possible, and stay away from public transport if you can. So these kind of things. Even if the government allows everything to open again, and I think some people will have to go to work, I understand that, but that virus is not gone yet, and it will pop up again. So we will have the next problems. Yeah.
Well, thank you so much for joining me. It's great to see you again, and stay healthy, stay home, and
You too.
stay, please. Okay, thank you.
Thank you.